Hello friends, today we will know what is the complication of IVF or ovulation induction regimens like ovarian hyperstimulation syndrome. Sometimes it happens that your ovaries are enlarged and the follicles which are formed are very big in size. So these may lead to a complication called ovarian hyperstimulation syndrome. Welcome, I am gynecologist Professor Dr. Ruchika Garg from Agra. So, how to identify that the patient who is undergoing IVF has developed OHSS? The patient, she may develop nausea, vomiting, abdominal pain, increased weight because of swelling, and or sometimes if it is severe, moderate, then you may have water in your belly, which is medically called ascites, or water in the lungs, which is called pleural effusion or hydrothorax, or sometimes it may be very severe or which is very unusual when it will be called so thromboembolism or emboli or blood clots may be formed in your blood vessels. So, who are the women who are more predisposed to developing these complications during IVF? Those who are lean, those who are having PCOS, those who have young age, or those who have a previous history of OHSS or ovarian hyperstimulation syndrome. They are more predisposed to developing OHSS. Nowadays, doctors are using antagonist protocols, so with that, the OHSS incidence is less compared to the agonist protocol. Which was used long protocol, which was used previously. So what is the reason? It is because of excessive HCG. Many times to trigger the ovulation for causing the burst of the follicles, HCG injection is given, which may cause OHSS. So the symptoms we have seen, that how to identify, but how the doctor will investigate and come to an conclusion. So by means of ultrasound we can know whether what is the ovaries are enlarged and the follicles are so many and they are also enlarged, and there may be water in the abdomen or there may be water in the lungs. So by means of ultrasound and certain blood tests we can know. So how to treat these patients? So treatment is just supportive. In cases of mild, when you have just nausea, vomiting, diarrhea or swelling, the doctor will give you treatment according to the symptoms you have. Like for nausea and vomiting, they will give you antiemetic drugs, or IV fluids can be given if you are not going to take oral fluids. And but if it is severe, the doctor may have to tap your fluid from the abdomen or from the lungs, or sometimes low molecular weight heparin might be given in severe cases to prevent the formation of blood clot. Aspirin, metformin and cabergoline, they are also effective. And so I have got so many videos on my channel. If you have any doubt regarding to OHSS or any gynecological problem, you can write in the comment section. And I would like to know how many of you have undergone IVF and how many of you have developed OHSS. So you need to just be vigilant and visit your doctor. So the doctor, if you are predisposed and if they feel like you are developing multiple follicles, and they may arrest giving HCG in that cycle, or they will measure your estrogen levels, and sometimes these patients may also develop electrolyte imbalances like sodium is less. So treatment is also supportive, but you need to be in touch with your doctor. Because if it develops into mild and moderate, then it's not a problem, but if it develops into severe, then you might need admission and strict follow-up, because it might cause you dyspnea or difficulty in respiration when the fluid is there in your lungs. Thank you for watching this video.